Question 1. What is the maximum duration you should interrupt chest compressions for a breath or to check for a pulse? A. No more than 5 seconds. B. No more than 10 seconds. C. No more than 15 seconds. D. No more than 20 seconds. Answer, B. No more than 10 seconds. This question tests your knowledge of minimizing interruptions during CPR, a critical factor for successful resuscitation. The keyword maximum duration emphasizes the strict time limit for pauses. High-quality CPR requires continuous chest compressions with minimal interruptions, so rescuers should never stop compressions for more than 10 seconds for any reason, including ventilations or pulse checks. This ensures the brain and vital organs receive a continuous supply of oxygenated blood. For instance, if you're giving breaths, you should deliver them quickly within that 10-second window. Remember, every second without compressions reduces the chance of survival. Question 2. When should you activate the emergency response system, call 911/EMS, for an unresponsive adult who is not breathing normally? A. After 2 minutes of CPR. B. Immediately after confirming unresponsiveness and abnormal breathing. C. After delivering 5 cycles of chest compressions. D. Only if an AED is not available. Answer, B. Immediately after confirming unresponsiveness and abnormal breathing. This question focuses on the crucial first step in the chain of survival for an adult. The keywords unresponsive adult and not breathing normally are key indicators of a cardiac arrest, prompting immediate action. For adults, the priority is to activate EMS as soon as you confirm unresponsiveness and no normal breathing, as rapid activation allows professional help to arrive quickly. This often means calling 911 or sending someone to do so while you prepare to start compressions. Remember to call for help first for adults to get the professionals on their way quickly. Question 3. What is the recommended compression to ventilation ratio for adult CPR with a single rescuer? A. 15 compressions to 2 breaths. B. 20 compressions to 2 breaths. C. 30 compressions to 2 breaths. D. 50 compressions to 5 breaths. Answer, C. 30 compressions to 2 breaths. This question assesses your understanding of the standard adult CPR ratio for one rescuer. The key phrase adult CPR with a single rescuer is crucial here, as ratios can differ for children, infants, or 2 rescuers. For a lone rescuer performing CPR on an adult, the guideline is to deliver 30 chest compressions followed by 2 breaths. This ratio balances the need for continuous blood flow with providing oxygen. Imagine counting 1, and 2, and 3, up to 30, then quickly giving 2 breaths. It's important to stick to this ratio to ensure effective CPR. Question 4. What is the appropriate hand placement for chest compressions on an adult? A. On the lower half of the breastbone, sternum. B. On the upper half of the breastbone, sternum. C. On the xiphoid process. D. On the ribs directly under the armpit. Answer. A. On the lower half of the breastbone, sternum. This question tests your knowledge of correct hand placement for effective adult chest compressions, which is vital for delivering blood to the brain and heart. The correct spot is on the lower half of the breastbone, or sternum, in the center of the chest. Placing your hands here helps ensure that compressions are applied to the heart area, avoiding injury to other organs like the xiphoid process, which is a small bony projection at the bottom of the sternum and can be easily fractured if compressed. Picture drawing an imaginary line between the nipples and placing the heel of one hand in the center of the chest, then placing the other hand on top. Proper hand placement helps prevent injuries and maximizes compression effectiveness. Question 5. When using an AED on an adult, where should the pads typically be placed? A. One pad on the left arm, one pad on the right arm. B. One pad on the upper right chest, one pad on the lower left side of the chest. C. One pad on the abdomen, one pad on the upper chest. D. One pad on the back, one pad on the front of the chest. Answer B. One pad on the upper right chest, one pad on the lower left side of the chest. This question focuses on the correct placement of AED pads for an adult, which is essential for the device to effectively deliver an electrical shock across the heart. The standard placement involves putting one pad on the upper right side of the chest, just below the collarbone, and the other pad on the lower left side of the chest, a few inches below the armpit. This anterior lateral placement ensures the electrical current passes through the heart. Think of it like a path for the electricity to flow through the heart. Always follow the pictures on the pads themselves for precise placement. Question 6. What is the primary method for opening the airway of an unresponsive adult who may have a neck injury? A. Head tilt chin lift. B. Jaw thrust maneuver. C. Back blows. D. Abdominal thrusts. Answer B. Jaw thrust maneuver. This question addresses a critical consideration in airway management: potential spinal injury. The keywords unresponsive adult and may have a neck injury immediately signal the need for a modified technique to avoid worsening a spinal injury. In such cases, the jaw thrust maneuver is preferred because it opens the airway by moving the jaw forward without tilting the head or neck. In contrast, the head tilt chin lift is the standard for individuals without suspected neck injuries. Always prioritize protecting the spine if there's any suspicion of trauma. Question 7. What is the recommended compression depth for adult chest compressions? A. At least 1 inch, 2, 5 cm. B. At least 1, 5 inches, 3, 8 cm. C. At least 2 inches, 5 cm, but no more than 2, 4 inches, 6 cm. D. At least 3 inches, 7, 6 cm. Answer C. At least 2 inches, 5 cm, but no more than 2, 4 inches, 6 cm. This question tests your knowledge of the correct depth for adult chest compressions, a key component of high-quality CPR. The phrase recommended compression depth highlights the specific guideline. For adults, chest compressions should be at least 2 inches, 5 cm, deep, but not exceed 2, 4 inches, 6 cm. Pushing deep enough ensures blood effectively circulates, while avoiding excessive depth prevents potential injury. Imagine pushing down roughly a third of the chest's depth. It's crucial to push hard and fast to move blood effectively. Question 8. A rescuer is performing CPR on an infant. What is the recommended compression to ventilation ratio for a single rescuer? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 20 compressions to 2 breaths. D. 50 compressions to 5 breaths. Answer B. 30 compressions to 2 breaths. This question checks your understanding of the CPR ratio specifically for a single rescuer performing CPR on an infant. The key phrase infant, single rescuer is important because ratios can change depending on the age of the patient and the number of rescuers. For a lone rescuer, the recommendation is 30 compressions followed by 2 breaths for an infant, just like for an adult or child. This consistency for single rescuers helps simplify the process, ensuring more compressions are delivered. Question 9. What is the first thing you should do when you find an unresponsive person? A. Immediately start chest compressions. B. Call 911/EMS. C. Check the scene for safety. D. Deliver 2 rescue breaths. Answer: C. Check the scene for safety. This question highlights the absolute first step in any emergency situation, ensuring your own safety and the safety of the victim. The phrase, "first thing you should do," emphasizes the priority of this action. Before approaching any unresponsive person, you must quickly scan the environment for hazards like traffic, downed power lines, or dangerous chemicals. You can't help someone if you become a victim yourself. For example, if someone collapses in the middle of a busy street, your first priority is to move them to a safe location if possible, or call for help from a safe distance, before you provide direct care. Always protect yourself first. Question 10. When performing CPR on a child, what is the recommended compression depth? A. Approximately 1 inch, 2, 5 cm. B. At least 1, 5 inches, 3, 8 cm, or about 1/3 the depth of the chest. C. At least 2 inches, 5 cm, or about 1/3 the depth of the chest. D. At least 2, 4 inches, 6 cm. Answer: C. At least 2 inches, 5 cm, or about 1/3 the depth of the chest. This question focuses on the correct compression depth for children, distinguishing it from infants and adults. The keyword child is crucial. For children, the recommended compression depth is at least 2 inches, 5 cm, or about 1/3 the depth of the chest. This depth is important to ensure effective blood flow while being appropriate for a child's smaller body size compared to an adult. Think about using 1 or 2 hands, depending on the size of the child, to achieve this depth. Remember to push deep enough to be effective, but not so deep as to cause injury. Question 11. What is the recommended rate for chest compressions for all age groups, adults, children, and infants? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question tests a universal guideline in CPR, the compression rate across all age groups. The phrase "all age groups" highlights that this specific parameter remains consistent regardless of whether you are resuscitating an adult, child, or infant. The recommended rate for chest compressions is 100 to 120 compressions per minute. This fast pace is crucial for maintaining adequate blood flow to vital organs. A good way to remember this is to compress to the beat of songs like "Stayin' Alive" by the Bee Gees. Question 12. If an adult suddenly collapses and is unresponsive, not breathing, and you are alone, what is the most appropriate sequence of actions? A. Check pulse, open airway, give 2 breaths, call 911. B. Call 911, get AED, if available, then start CPR. C. Start CPR, give 2 breaths, then call 911. D. Open airway, check breathing, start chest compressions. Answer: B. Call 911, get AED, if available, then start CPR. This question tests the call-first approach for a lone rescuer with an adult victim, which is a critical part of the BLS chain of survival. The keywords "adult suddenly collapses," "unresponsive," "not breathing," and "alone" indicate a likely cardiac arrest requiring immediate professional help. For an adult who collapses suddenly, the priority is to activate the emergency response system, call 911/EMS first, and if an AED is nearby, retrieve it, before initiating CPR. This ensures that advanced medical help and defibrillation arrive as quickly as possible. Always prioritize getting help on the way for adult cardiac arrest. Question 13. What is the recommended method for checking for breathing in an unresponsive adult? A. Listen for breath sounds for 5 to 10 seconds. B. Look, listen, and feel for breath for at least 10 seconds. C. Look for chest rise and fall for 5 to 10 seconds. D. Place your hand on their chest and feel for movement. Answer, C. Look for chest rise and fall for 5 to 10 seconds. This question focuses on the updated guidelines for assessing breathing in an unresponsive person. The keyword recommended method emphasizes the current, streamlined approach. You should visually check for chest rise and fall for 5 to 10 seconds to determine if the person is breathing normally. The look, listen, and feel method for breathing assessment is no longer recommended for lay rescuers. A quick visual check is sufficient. If there's no normal breathing or only gasping, assume cardiac arrest and proceed with CPR. Question 14. After administering naloxone for a suspected opioid overdose, what should you do next if the person is still unresponsive and not breathing normally? A. Wait for EMS to arrive without further action. B. Continue with chest compressions and rescue breaths. C. Place them in the recovery position immediately. D. Give another dose of naloxone. Answer, B. Continue with chest compressions and rescue breaths. This question tests your understanding of the combined approach when dealing with a suspected opioid overdose. The keywords still unresponsive and not breathing normally after naloxone administration indicate that even if naloxone has been given, the underlying issue of respiratory or cardiac arrest may still be present or worsening. Therefore, if the person doesn't immediately wake up and breathe normally, you must continue with chest compressions and rescue breaths, CPR, until they recover or advanced medical help takes over. Naloxone is not a substitute for CPR if breathing stops or is ineffective. Question 15. When should you use child AED pads instead of adult pads? A. For children aged 12 years and older. B. For children younger than 8 years old or weighing less than 55 pounds, 25 kg. C. Only for infants younger than 1 year old. D. For any child who fits the adult pads. Answer, B. For children younger than 8 years old or weighing less than 55 pounds, 25 kg. This question clarifies the specific age and weight criteria for using child-sized AED pads. The key phrase, child AED pads, signals a need to differentiate from adult pads. Child pads, attenuated pads, are recommended for children younger than 8 years old or weighing less than 55 pounds, 25 kg. These pads deliver a lower dose of electricity, which is safer and more appropriate for a child's smaller body. If child pads are unavailable, adult pads can be used, ensuring they do not touch each other on the child's chest. Question 16. During true rescuer infant CPR, what is the recommended compression to ventilation ratio? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 20 compressions to 2 breaths. D. 50 compressions to 5 breaths. Answer. A. 15 compressions to 2 breaths. This question specifically addresses the CPR ratio for 2 rescuers performing CPR on an infant. The keywords 2 rescuer infant CPR are critical, as this scenario has a different ratio than single rescuer or adult CPR. When 2 rescuers are present for an infant, the recommended ratio is 15 chest compressions followed by 2 breaths. This increased frequency of breaths relative to compressions is due to the higher likelihood of respiratory issues being the primary cause of arrest in infants and children. Two rescuers can more easily coordinate this ratio. Question 17. What is the main purpose of delivering rescue breaths during CPR? A. To cool down the body. B. To remove toxins from the body. C. To provide oxygen to the lungs. D. To help circulate blood. Answer, C. To provide oxygen to the lungs. This question focuses on the fundamental reason for rescue breaths in CPR. The keyword main purpose directs you to the primary goal of this intervention. Rescue breaths are delivered to provide oxygen to the victim's lungs, which then gets absorbed into the bloodstream and circulated by chest compressions. While compressions circulate blood, breaths ensure that the blood being circulated is oxygenated. Think of it as refilling the oxygen tank so the pump, compressions, has something to push around. Question 18. If a conscious adult is choking and cannot speak, cough, or breathe, what is the first step you should take? A. Begin chest compressions. B. Call 911 immediately. C. Deliver 5 back blows followed by 5 abdominal thrusts. D. Check for a pulse. Answer, C. Deliver 5 back blows followed by 5 abdominal thrusts. This question addresses the immediate action for a conscious adult who is actively choking and showing signs of severe airway obstruction. The keywords conscious adult, choking, and cannot speak, cough, or breathe confirm a severe obstruction. For a conscious adult with a severe airway obstruction, the initial and immediate intervention is to deliver 5 back blows between the shoulder blades, followed by 5 abdominal thrusts, Heimlich maneuver. You should continue alternating these until the obstruction is relieved or the person becomes unresponsive. This sequence aims to dislodge the foreign object. Question 19. What should you do if an adult becomes unresponsive while you are performing abdominal thrusts for choking? A. Continue abdominal thrusts. B. Immediately call 911 if not already done, and then begin CPR, starting with chest compressions. C. Open the airway and give 2 rescue breaths. D. Perform a finger sweep to check for the object. Answer, B. Immediately call 911 if not already done, and then begin CPR, starting with chest compressions. This question presents a critical transition point in choking management. The keyword becomes unresponsive while choking means the situation has escalated to a cardiac arrest scenario. If a choking adult becomes unresponsive, you should immediately call 911, if not already done, and then begin CPR, starting with chest compressions. Each time you open the airway to give breaths during CPR, look for the foreign object in the mouth and remove it if seen. Do not perform blind finger sweeps, as this can push the object further down. Question 20. When should you perform a pulse check on an unresponsive person? A. Before calling 911. B. For no more than 10 seconds after checking for responsiveness and breathing. C. After delivering 5 cycles of CPR. D. Only if an AED is available. Answer, B. For no more than 10 seconds after checking for responsiveness and breathing. This question clarifies the timing and duration of a pulse check in the BLS sequence. The critical phrase pulse check and no more than 10 seconds emphasizes the brief window for this assessment. After confirming unresponsiveness and absence of normal breathing, you should check for a pulse for no more than 10 seconds. If you don't feel a pulse within that time, or are unsure, you should immediately begin chest compressions. For lay rescuers, if you see no normal breathing, assume cardiac arrest and start compressions, often skipping a formal pulse check entirely to save time. Question 21. What is the recommended hand placement for chest compressions on an infant? A. 2 fingers on the lower half of the breastbone, just below the nipple line. B. 1 hand on the upper half of the breastbone. C. 2 hands interlocked on the center of the chest. D. On the abdomen just above the navel. Answer. A. 2 fingers on the lower half of the breastbone, just below the nipple line. This question addresses the specific hand placement for infant chest compressions, which differs significantly from adults and children. The keyword infant is crucial here. For a single rescuer performing CPR on an infant, the recommended hand placement is 2 fingers, index and middle fingers, on the lower half of the breastbone, just below the nipple line. This technique ensures effective compressions while being appropriate for an infant's small chest. If 2 rescuers are present, the 2-thumb encircling technique is preferred, but for a single rescuer, 2 fingers are standard. Question 22. What should you do if an AED delivers a no shock advised message? A. Turn off the AED and wait for EMS. B. Continue with CPR, starting with chest compressions. C. Place the person in the recovery position. D. Remove the pads and check for a pulse. Answer. B. Continue with CPR, starting with chest compressions. This question tests your understanding of what to do when an AED analyzes a heart rhythm but does not recommend a shock. The phrase, no shock advised, means the AED has detected a rhythm that does not respond to defibrillation, such as asystole, no electrical activity, or pulseless electrical activity. In this scenario, you must immediately resume high-quality CPR, starting with chest compressions, until the AED reanalyzes, EMS arrives, or the person shows signs of life. The AED is guiding you to continue manual chest compressions to try and restore a shockable rhythm or maintain blood flow. Question 23. You are performing CPR and a second trained rescuer arrives. What is the most effective way for them to help? A. Take over rescue breaths immediately. B. Take over chest compressions immediately. C. Call 911 again to confirm they are on the way. D. Assist with preparing the AED and rotate rolls every 2 minutes. Answer. D. Assist with preparing the AED and rotate rolls every 2 minutes. This question addresses team dynamics in CPR, which is crucial for high-quality resuscitation. The keyword second trained rescuer arrives highlights the opportunity for more efficient and effective CPR. The most effective way for the second rescuer to help is to assist with preparing the AED, if not already done, and then rotate rolls, specifically chest compressions, every 2 minutes, or 5 cycles, to prevent rescuer fatigue. Fatigue leads to a decrease in compression quality, so rotating rolls ensures continuous high-quality compressions. Question 24. A child is responsive but choking and has a severe airway obstruction. What is the initial action? A. Encourage the child to cough. B. Administer 5 back blows followed by 5 abdominal thrusts. C. Call 911 immediately. D. Start chest compressions. Answer. B. Administer 5 back blows followed by 5 abdominal thrusts. This question focuses on managing a conscious child with a severe choking incident. The keywords responsive, choking, and severe airway obstruction, meaning they cannot cough, speak, or breathe effectively, indicate immediate intervention is needed. For a conscious child experiencing a severe choking emergency, the initial action is to perform 5 back blows followed by 5 abdominal thrusts, alternating until the object is dislodged or the child becomes unresponsive. This is the same sequence as for an adult. Question 25. What is the correct way to open the airway of an unresponsive person without a suspected neck injury? A. Jaw thrust maneuver. B. Head tilt chin lift. C. Place them in the recovery position. D. Administer a back blow. Answer B. Head tilt chin lift. This question tests the standard technique for opening an airway when there's no suspicion of a spinal injury. The crucial phrase, without a suspected neck injury, indicates that the simpler, more common method is appropriate. The head tilt chin lift maneuver is the recommended way to open the airway for an unresponsive person in this scenario. This technique gently tilts the head back and lifts the chin, which moves the tongue away from the back of the throat, clearing the airway. It's the go-to method when spinal injury isn't a concern. Question 26. What should you do if an infant is choking and becomes unresponsive? A. Continue back blows and chest thrusts. B. Immediately start CPR, beginning with chest compressions. C. Call 911 if you haven't already, then open the airway and try to visualize the object. D. Perform a blind finger sweep. Answer B. Immediately start CPR, beginning with chest compressions. This question describes a critical escalation in an infant choking situation. The key phrase, becomes unresponsive, means the infant is now in cardiac arrest. If a choking infant becomes unresponsive, you should immediately begin CPR, starting with chest compressions. Each time you open the airway to give breaths during CPR, look for the foreign object in the mouth and remove it if seen. Remember, for an unresponsive choking victim of any age, the treatment shifts to CPR. Call 911/EMS as soon as you determine the infant is unresponsive if you haven't already done so. Question 27. How long should you check for normal breathing and a pulse on an unresponsive person? A. At least 30 seconds. B. No more than 10 seconds. C. Exactly 15 seconds. D. Only if you hear gasping. Answer B. No more than 10 seconds. This question emphasizes the critical time limit for assessing an unresponsive person. The key phrase, how long should you check, and the assessment of normal breathing and a pulse points to a strict time window. You should check for normal breathing and a pulse for no more than 10 seconds. If you don't find a definite pulse or normal breathing within this time frame, or are unsure, you should assume cardiac arrest and begin chest compressions immediately. This minimizes delay to critical chest compressions. Question 28. What is the main characteristic of agonal gasps, and how should you respond to them? A. They are normal breathing, wait and monitor the person. B. They are noisy, ineffective breaths, treat as not breathing normally and start CPR. C. They are deep, slow breaths, encourage the person to take more. D. They indicate a partial airway obstruction, deliver back blows. Answer B. They are noisy, ineffective breaths, treat as not breathing normally and start CPR. This question tests your ability to recognize and correctly interpret agonal gasps, which are often confused with normal breathing. The keywords, main characteristic, and how should you respond are important. Agonal gasps are typically noisy, irregular, and may sound like gasping, snorting, or gurgling, but they are not effective breathing. They are a sign of cardiac arrest. If you observe agonal gasps, you should treat the person as not breathing normally and immediately begin CPR, starting with chest compressions. Do not delay CPR due to these ineffective breaths. Question 29. What is the primary reason for providing early defibrillation with an AED? A. To help the heart pump blood more effectively. B. To stop chaotic electrical activity and allow the heart's natural pacemaker to restart. C. To provide oxygen to the heart muscle. D. To break up blood clots in the heart. Answer B. To stop chaotic electrical activity and allow the heart's natural pacemaker to restart. This question delves into the fundamental mechanism of how an AED works and its importance in cardiac arrest. The keyword primary reason emphasizes the core function of defibrillation. The main purpose of an AED is to deliver an electrical shock that stops the chaotic electrical activity, like ventricular fibrillation, in the heart. This allows the heart's natural electrical system to potentially reset and resume a normal rhythm. It doesn't restart a completely flatlined heart but rather corrects a disorganized one. Think of it as hitting a reset button for the heart's electrical system. Question 30. Where should an infant who is responsive and choking, but unable to cry or cough forcefully, receive back blows? A. While lying flat on their back. B. With the infant lying on their side. C. With the infant face down, head lower than the chest, supported on your forearm. D. While sitting upright on your lap. Answer C. With the infant face down, head lower than the chest, supported on your forearm. This question describes the correct positioning for delivering back blows to a conscious, choking infant. The keywords infant, responsive and choking, and unable to cry or cough forcefully point to a severe airway obstruction requiring intervention. The correct technique involves holding the infant face down along your forearm, with their head lower than their chest, while supporting their head and neck. This position uses gravity to help dislodge the object when combined with back blows. This specific positioning is critical for safety and effectiveness. Question 31. What is the correct sequence of steps for using an AED? A. Turn on AED, attach pads, analyze rhythm, deliver shock, if advised. D. B. Attach pads, analyze rhythm, turn on AED, deliver shock. C. Deliver shock, attach pads, turn on AED, analyze rhythm. D. Analyze rhythm, attach pads, turn on AED, deliver shock. Answer A. Turn on AED, attach pads, analyze rhythm, deliver shock, if advised. D. This question tests your knowledge of the correct, sequential steps for operating an AED, which is crucial for effective and safe defibrillation. The correct sequence is to first turn on the AED. Then, attach the electrode pads to the patient's bare chest. Next, allow the AED to analyze the heart rhythm. Finally, if a shock is advised by the device, ensure everyone is clear and deliver the shock. Following these steps in order ensures the AED can function properly and safely. Question 32. What is the primary goal of continuous, high-quality chest compressions during CPR? A. To cool the body down. B. To oxygenate the lungs. C. To create artificial blood flow to the brain and heart. D. To stimulate breathing. Answer C. To create artificial blood flow to the brain and heart. This question focuses on the fundamental purpose of chest compressions in CPR. The keywords primary goal and high-quality chest compressions emphasize the critical function. The main objective of chest compressions is to manually pump blood from the heart to the brain and other vital organs, creating artificial blood flow when the heart has stopped. This temporary circulation is essential to keep cells alive until the heart can restart or advanced medical care takes over. Think of your compressions as manually taking over the heart's job of pumping blood. Question 33. You find an adult unresponsive, not breathing normally, and you suspect an opioid overdose. What should be your first action after ensuring scene safety? A. Administer naloxone immediately. B. Start chest compressions. C. Call 911/activate emergency response and then consider naloxone. D. Open the airway and check for a pulse. Answer: C. Call 911/activate emergency response and then consider naloxone. This question presents a scenario involving an opioid overdose and requires prioritizing actions. The keywords unresponsive, not breathing normally, suspect an opioid overdose, and first action are crucial. While naloxone is important for opioid overdose, the immediate priority for an unresponsive person not breathing normally is to activate the emergency response system, call 911/EMS, first. After calling for help, you should consider administering naloxone if available and train to do so, while preparing to or beginning CPR if necessary. Activating EMS ensures professional help arrives quickly to manage the situation. Question 34. What does the term recoil refer to in the context of chest compressions? A. The rate at which compressions are delivered. B. The depth of each compression. C. Allowing the chest to fully re-expand after each compression. D. The hand placement on the chest. Answer: C. Allowing the chest to fully re-expand after each compression. This question defines a key component of high-quality chest compressions. The term recoil refers to allowing the chest to fully re-expand to its normal position after each compression. Full chest recoil is essential because it allows the heart to refill with blood before the next compression, ensuring effective blood flow. Leaning on the chest and not allowing full recoil can reduce blood flow. Think of it like a pump needing to fully release to draw in water before it can push it out again. Question 35. You are caring for a child who collapses and is unresponsive, not breathing normally. You are alone? When should you activate the emergency response system, call 911/EMS? A. After 1 minute of CPR. B. Immediately after confirming unresponsiveness and abnormal breathing. C. After 2 minutes, 5 cycles, of CPR. D. Only if an AED is not available. Answer: C. After 2 minutes, 5 cycles, of CPR. This question tests a key difference in the BLS sequence for children/infants compared to adults, especially for a lone rescuer. The keywords child who collapses, unresponsive, not breathing normally, and alone are critical. For a lone rescuer with a child, or infant, who collapses, the compressions first approach is used. You should perform 2 minutes, about 5 cycles, of CPR before activating the emergency response system. This is because respiratory arrest is a more common cause of cardiac arrest in children, and providing initial breaths and compressions can be more beneficial before professional help arrives.